What would you tell someone? Okay, so because we're going to have to like leave the midwives out of this because that's your situation. What would you tell someone they need to do as a patient when they get to the hospital as a transfer?
Quickly give me as much information as you can to tell me about your history of your pregnancy, your past history, and what has been happening in the most recent few hours. Because I can't tell you how many people then go, oh, by the way, I've got this platelet thing, I've got I've got this thing, you know what I mean? Like people have history that they've been told that's not so important in terms of your delivery. So we won't think about that. Or, oh yes, I've had a cardiac problem, like, or things that are in their history that for me are huge red flags all over the place, which I would have worked up immensely before they came to delivery. So immediately I need to, like, the most major medical things, you need to tell me about those right now. And you need to tell me anything that's happened in your pregnancy that seemed at all out of the ordinary. And then what's been happening during your labor and the last day or few hours that it's been going on. And you have to take that at their word and use that information to make your plan. And sometimes it's not ideal, but the history, I mean, history is so important in making your decisions as to what to do next.
I was going to say everything is important. All information is important. That's the hardest thing is um, what are things that you think people are hesitant to tell you that really, really need to be told to you up front? How long they've been laboring, how long their water's been
How long the
ruptured.
water's been broken, what was the color of the amniotic fluid, how many exams have you had? Because, it's certainly possible that if things have been going on and not going well, they may have been examined 3, 4, 10 times, as things are going on and increasing their chance for infection. You want to maybe get an antibiotic started right away if they need it. Prior birth history, because, maybe this person had a C-section last time and they were trying to have a VBAC at home. And of course, that changes things immensely based on how much pain they're in, how long have they been laboring, what have they been doing. Anything that might change my idea about how I need to take care of this person. Anybody quantifying how much blood you've lost? Like, what were the sheets on your bed at home like soaked with blood before you got here? Or was there, compared to a period, how much blood have you seen come out? You have to do it in ways that people can quantify and tell you what has gone on so far, so you can immediately start to make some decisions.
What procedures do you want your patients to consent to ideally when they come in? I'm assuming like IV access is big one. You
Yeah.
really, really want to see that happen.
Yeah. IV access. It's hard to say to someone, I need you to consent to everything I need to do to save your life, because there's a lot of different things. I do think that in this situation, you have to be really clear about the things as they're going along, like consent to possibly me using an instrument to bring the baby out. If you can push the baby down far enough for me to safely instrument the baby out, here's the benefit of that. Here's the risk of that. If you say okay to that, let's go and move towards that. Because I've had a couple of people come in where they were pushing and pushing and pushing and pushing, and all they really needed was that last little bit, like with a vacuum or with forceps or something, to get the baby out. But if they don't consent to that, you really can't do it. So consenting to instrumental delivery, if you're at the point where that seems like the way to go, um, you know, getting a blood test right away, checking where they're coming in for their blood count, because if they're already coming in terribly anemic and then you're losing a lot of blood and you don't know how much they already lost, you're going to be talking about a blood transfusion, and I mean, people are afraid of these things. So while this is really hard to have all these conversations in an emergent situation, those are all the things you do have to talk about, getting blood work done, possibly getting blood, possibly an iron infusion if they don't want blood, but they're willing to get something else that might prop them up. Of course, C-section, if it comes to that, which, it may by the point that they come in after laboring for so long or after something else happening where it doesn't seem like they're going to be having a vaginal delivery. you know, one by one, I would have to do them all separately.